Behavior analysts often face situations that are complex. Engaging in ethical decision-making processes is an important skill to develop as a part of professional competence. One strategy to use to engage in ethical decision-making is the risk-benefit analysis. It is data-driven and provides a clear structure for the process. This model of the risk-benefit analysis relies on the use of the ethics code for behavior analysts from the Behavior Analyst Certification Board and the BCBA test content outline that offers an overview of skills and knowledge that the Behavior Analyst Certification Board considers to be important for practitioners. This version of a risk-benefit analysis is divided into 4 steps. And the first step has 4 steps in and of itself. And in step 1, you're clearly identifying the situation. You're clearly writing out what is the decision you need to make, what is the conflict or issue that you're facing. So you really want to be clear about the situation. And then you're going to identify your professional responsibility. And this is where we use the test content outline to guide us in those professional skills that we should have, in those elements of professional knowledge that we should have. So what's your professional responsibility in the situation? And then you're going to identify the relevant ethical codes. You're going to go through the code of ethics for behavior analysts, and you're going to identify any ethical codes that seem to match this particular situation. And then you're going to identify as many potential decisions as you can. So what are the options for decision making? At this stage, you're not eliminating any, you're not putting value judgment on them. You're just identifying the potential decisions that you're going to consider and that you're going to put through your risk-benefit analysis. Now in step 2, we're going to gather relevant data for each potential decision. So you're going to do some research here. You're going to gather your data so that you're able to make data-driven decisions. This is important as behavior analysts for us to really stay in the data, get as much research and data as we can. Then in step 3, you're going to complete a risk-benefit analysis worksheet. So you're going to use this procedure and you're going to just detail it all out. You're going to write it down. So we don't want to do a risk-benefit analysis in our head. This is a very structured and systematic process. And so that's step 3. And then step 4 is the decision process. So you make your decision. And then the second part of that is you communicate that decision to whoever needs to be informed of it. And then you're going to document the decision-making process and the decision. So this means you're going to, in your files, include your risk-benefit analysis worksheet. You might include some of that research that you did. You might include some notes with the relevant information about the ethics code and about the professional responsibilities. So you're going to have all of that in your files. You're going to document the decision that you made and the process that you used to get to that decision. And you do want to make sure that everybody who's relevant knows the decision that you've made and that you've really allowed other people to be informed within the process. The risk-benefit analysis tool is great to use independently when you're facing a dilemma or a situation within your professional workload. But it's also great to use in a small group setting. So if you're working collaboratively with other people, you can conduct a risk-benefit analysis like this with multiple people. And this is really good for getting clarity and helping you get on the same page as you're engaging in the decision-making process. In step 1, you're going to clearly identify the situation. So you're writing it out, just like you would an operational definition for a behavior. You're writing out the situation. You might even include examples and non-examples. You want to be as specific and clear as you can. And then you want to identify the professional responsibilities. So this includes that test content outline that I mentioned. So those skills and knowledge that the board expects us to have as behavior analysts. Also, you might be looking at some of the laws and regulations within your own jurisdiction, some of the requirements for behavior analysts in the area in which you practice, maybe within your company and organization as well. And so what this might look like from the test content outline, I might say, oh, there's E1, E2, and E12 are all relevant, and then I would write those out from the TCO. So I would have them and they would be clear. And for example, E2 is to identify the risks to oneself, others, and the profession as a result of engaging in unethical behavior. So if that was relevant to the situation, I would write that out. So I would have that and it would be clear. And then I might hone in on which one was the most clear. If I had multiples there, I might highlight or underline the one that's most important as I'm documenting it. And then you're going to identify the relevant ethical code. It's so important for us to make ethical decisions, to engage in ethical decision-making processes. So we want to always be reverting to and reviewing the ethics code for behavior analysts from the Behavior Analytics Certification Board. The most recent one, 2020, is what I'm using here. And so I might be looking at things like 2.01, providing effective treatment, or 2.15, minimizing risk of behavior change interventions. And I would write those out if those were relevant to my situation, so I know which ethical code I'm addressing and which one is relevant to this particular dilemma or situation. And finally, the last part of step 1 is to identify potential decisions. So I'm going to be clear, if I have more than one potential decisions, I want to write them out, as many as I can think of that I might want to run through the risk-benefit analysis so that I'm evaluating well all of my different options, or if it's a group, all of our different options for how we might make a decision in a particular situation. In step 2, we're gathering relevant data. So one of the things that we look at when we're gathering data is if we need additional clarification. Sometimes when we're writing out the situation, we're writing out our options, we realize that we're missing some pieces of information and we need to ask questions from other people involved, questions from stakeholders. So this is where you're going to gather that additional clarification and ask those questions, get that information. You might also engage in some research. Actually, you probably will engage in some research, some evidence gathering for this process, especially as it relates to each of those potential options that you've identified. You want to do the research on those options and know what the evidence says and when it relates to those things. So you might be looking at research articles, you might be looking at books and other material, and you might also be looking to consult with other people. So maybe there are other behavior analysts, other people in the field. You might be needing to get consultation from people outside of the behavior analytic field, maybe in other healthcare related fields, other mental health fields. So you might need to get some consultation from outside of your field or within your field. You might need to find somebody who's got some specific experience. So step 2 is gathering as much relevant data as you can to help you make informed decisions. The risk-benefit analysis approach relies on systematically identifying and writing down risks and benefits for each option. A worksheet is an effective tool to use for this task. I have provided a simple risk-benefit analysis worksheet. It's a modification of a template from the workbook developed by Kazemi, Rice, and Adesyan in 2019, Evidence-Based Strategies for Developing Competence Through Supervision. The source they cited for their version is Bailey and Birch 2016 in Ethics for Behavior Analysis, 3rd edition. You can create your own template or layout if you want. The key is an organized structure for identifying the risks and benefits for each option, and for documenting your analysis and any relevant notes. Generally, I try to encourage identifying 3 or more risks and benefits. Once you have those written down, you summarize the risks versus the benefits in 2 to 3 sentences. The final step, step 4, is decision making. To do this, you review the summaries for all of your options and you make the best data-based ethical decision that you can. You then communicate that decision to all of the relevant stakeholders. Depending on your workplace setting, you might be communicating to clients, colleagues, technicians, practice managers, parents, teachers, administrators, or other relevant individuals. Depending on the situation you've been dealing with, your communication might be in person or it might be written communication of the decision. The final step is to keep documentation of the decision and your decision-making process in your files. This will include your risk-benefit analysis worksheet, research, and notes that have been relevant to your decision making. Let's walk through an example scenario. I modified this scenario from the evidence-based strategies for developing competence through supervision that I previously referenced. So in this situation, you're providing behavior analytic services for a young learner. The parents have requested inclusion of alternative treatments as a part of your treatment plan. The alternative treatments they are suggesting come from a natural remedies approach and include using CBD and camel milk and other herbal remedies and vitamins. So you've got a couple of possible decisions or possible options here. Decision 1, you could agree to the parent's request. Include the alternative treatments with your behavior analytic services in your treatment plan. Provide good services and hope the parents change their mind about the alternative treatments. Decision 2, present evidence for the recommended effective ABA treatments and against alternative treatments. Decline to include alternative treatments in your treatment plan and encourage them to continue with behavior analytic services. In this situation, you identify the professional responsibilities utilizing the test content outline, and you specifically hone in on the risks to yourself and the profession as a result of engaging in unethical behavior. So that's E2, and identifying and applying the legal, regulatory, and practice requirements, licensure, jurisprudence, funding, certification relevant to the delivery of behavior analytic services. And as you're thinking about these treatments and the regulations around them and what could possibly be considered unethical, you've identified these two for professional responsibilities. Next, you look at the code of ethics. What's your ethical responsibility? And you identify 2.01, providing effective treatment. So this reads, behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles, based on scientific evidence, and designed to maximize desired outcomes for and protect all clients, stakeholders, supervisees, trainees, and research participants from harm. Behavior analysts implement non-behavioral services with clients only if they have the required education, formal training, and professional credentials to deliver such services. So now you're thinking about the situation where you've been asked to include these natural remedies, these natural treatments in your treatment plan. So you do some research because you don't really know about how it would even look to include treatments such as camel's milk in the diet, replacing regular milk with camel's milk, using CBD oils. Like, you don't know what that would look like, so you begin to do some research using evidence-based journals that are scientific and are well respected. And then you decide to do additional research, some consultation. Maybe you talk to a pediatrician specializing in children with disabilities. You ask them what their experience is, what the risks are, if you were to include any of these, what they know about these treatments. So you really get your good data here. Next step is I get into my worksheet. So I've written out the situation, the relevant professional responsibilities, the relevant ethics codes, and then I identify the decision option. And in this one, the decision option is to go along with the request to include alternative treatments as a part of the treatment plan. So the first risk that I'm going to identify is that adding alternative treatments could result in overall lower quality services. So I've done an analysis, and the notes that I put here are the treatment alternatives could interfere with the current treatments and reduce the progress for my client. So the next risk that I've identified is the positive progress. Any positive progress that's made going forward could be mistakenly attributed to the alternative treatment instead of the ABA treatment. So if we've got both going on here, the parents could assume that the positive progress came from the alternative treatment. So the analysis here is that the family could discontinue ABA services and treatment based on a belief that the progress is due to the alternative treatment, which would result in the potential harm to the client. So that's an important analysis for me to consider. My third risk here is that going along with the alternative treatments as a part of my treatment plan fails to meet my ethical standards, my ethical requirements, and is a violation of the codes. And here I've identified several codes, including 1.01, 2.09, and 6.01. So this is really important for me. I do not want to fail to meet the ethical standards. So another risk that I've identified is if these alternative treatments fail, the family may pursue even riskier options. So once I've agreed to go down this path, that could lead us to even more harmful options. This could result in harm to the client if there are side effects from riskier treatments, and could result in lower success overall. So the final risk that I've identified here for this particular decision is that the family may expect me to implement these alternative treatments. So since I've gone ahead and included them in my treatment plan, they might expect me to implement them. And I would have to refuse that because I'm unqualified to implement these treatments. I don't know enough about how you would implement them, about dosages, about scheduling. I just don't know enough about them. I don't have any experience in them, any training in them. These natural treatments are foreign to me, and so I would have to decline and refuse to implement them, even though I put them in my treatment plan. So now I'm going to look at the benefits. What are the positives if I do agree to this request and include these natural treatments in my treatment plan? So the first is the parents are not likely to interrupt services. They're likely to continue their current services with me. So there's no risk of the family leaving due to conflict because we're agreeing to the request and there's no conflict there. So the second benefit is the possibility of alternative treatments resulting in positive change. So the way I've analyzed this is there is some research that suggests that under some circumstances, these treatments are sometimes effective. So there's a low probability of effectiveness, but it's potentially non-zero. So there might be some benefit in these treatments to the client. So another benefit is that it minimizes conflict with family, which may help increase and build that rapport that's so valuable and important, getting that additional buy-in. So disagreements or conflicts might be aversive to parents. And so as I'm analyzing this, I'm thinking that those disagreements and conflicts could result in them considering discontinuing services or requesting new practitioners. But if we minimize that conflict and we continue to build rapport, that could be really positive overall for our therapeutic relationship. And the final benefit that I've listed here is that parents are pursuing help for their child. So in my analysis, I acknowledge, man, they're willing to do anything, to consider anything, to think outside the box. So this could correlate to a higher commitment to ABA treatments because they're so motivated to help their child. So then I summarize this risk versus benefits for my decision-making process. And the primary benefit of choosing to go along with the parent's request to include alternative treatments is the elimination of conflict between myself and the parents. Since there's not significant research or evidence to empirically validate the effectiveness of these treatments, the potential for successful outcomes from implementation is low. If the evidence-based ABA treatments are effective, there's a strong possibility that the positive outcomes will be credited to the alternative treatments instead, which increases the chance that the family will focus on the alternative treatments and not the ABA treatments. So that's my summary, which I'm going to use when it comes to the time to make my decision. So then the time comes in our situation to make a decision, and we want to make the most ethical decision that we can based on the best data that we've been able to gather. So in this situation, the chosen decision that I would make is to present the evidence for ABA treatments and against the alternatives and decline to include the alternatives into the treatment plan and encourage the parents to continue ABA services. Now I do want to make a little note here that I'm not saying that I'm forbidding or not allowing the parents to make their own decisions about using natural remedies or which milk to use in their home. This is about including these treatments in the treatment plan, in the behavior change treatment plan. So it's specifically about including them in the professional behavior analytic work that we're doing. We allow the parents and the stakeholders, the people, to make their own decisions in their own lives and in their own families. We're not like stepping into that realm here. We're just making the decision based on what we're going to be able to include in our behavior analytic practice. Okay, so having said that, so I make the decision and then I communicate that decision to the relevant stakeholders. So in this case, it would be the parents, maybe to a practice manager. I might let technicians know, other people who are involved in delivering the behavior analytic plan that we've developed. So I've communicated it, and I might communicate it in meetings. I might communicate it in a letter or an email. If I communicate it verbally in meetings, then I'm going to make notes on those meetings so that I can save that in my file and as a part of my documentation. I'm going to save all of my documentation here, my risk benefit worksheet, the evidence that I gathered, the research I did, notes on meeting with the doctor, all of that in the situation, the correspondence with the parents or the meeting notes, and any documentation that I provided of notification to any other stakeholders. So if I had to notify anybody else in this process, then I'm going to include that in my files, and I'm going to be able to have that as a record of my ethical decision making. For supervised unrestricted field work, I've provided some role play scenarios, and I'd like you to conduct a risk benefit analysis using the worksheet that I've provided as well, so that you can get some practice with this. And then if you would send me that evidence, then we'll have your risk benefit analysis worksheet as a permanent product of the competencies that you're developing and your skill in this particular practice. I'd also like you to make some notes to discuss the risk benefit process in an upcoming group supervision meeting. This is a great topic for us to discuss together collaboratively, some of the variables that might come up when we're conducting a risk benefit analysis, some of the questions that you might have, or some of the insights that you had as you practiced the skill and got a little better at it. So if you make some notes that you can participate in a discussion at a group supervision meeting, that's also supervised unrestricted field work. And these are a couple of really good ways for you to get that unrestricted field work and to build these skills that will help you really function ethically in your behavior analytic practice.